So one of the areas that I try to express to clients post purchasing a policy is what happens if, God forbid, they do have to file a claim and how that whole process works, that they're working directly with the insurance carrier. Maybe they do need to bring on representation for themselves, and what my involvement or lack thereof would be at the time that they end up having to use one of these policies.
So I think the insurance claims process is straightforward but confusing.
Mm-hmm.
And there are four elements to every claim. The first is the insurance policy, which outlines the terms and conditions and definitions that govern that claim. The second is the medical. And it's important for people to understand that a diagnosis does not equal disability. And we'll talk about that in a second. The third is the occupational component. What does that person do for a living? What documentation do they have substantiating that? And how that relates to the medical and showing functional impairments, or the buzzwords being restrictions and limitations that prevent or limit them from working in the occupation. And the fourth component is the economic loss. So when I'm working with my clients, many clients will reach out to me because they're dealing with a medical issue that is having a significant toll on their life. And they just don't have the capacity to try to manage if they're partial, trying to stay in practice and this insurance claim on top of it. So when we talk about the medical component, each policy has an appropriate care provision. So I started by saying a diagnosis does not equal disability, meaning an insured has to show that they have an injury or sickness, that they're getting appropriate care with qualified professionals, medical professionals, and that they've availed themselves to reasonable and appropriate care. If they're not doing that, then they haven't shown that they're getting appropriate care. And in that capacity, they've in essence limited themselves from presenting a claim because the company will look and say, where is the medical evidence? So it's important for these physicians or other professionals to see their doctors and to also be an open book with their doctors. It's oftentimes when I'm looking at files where I'll have a client tell me, these are all my complaints. And I'll look at the medical records. So where are the complaints? Have you talked to your doctor about that? Well, no. And again, I'm this way. I'm not sure if you are, or I used to be, I should say, till I got involved in this industry. People are stoic. They don't like to appear vulnerable. They don't like to appear like there's something wrong with them. It's especially true with doctors, given the fact that you've dedicated your life and your career to fixing people and helping them. So when there's something wrong with them and it's affecting their quality of life and their ability to work in their occupation, addressing that and acknowledging that and admitting that I'm not able to do what I used to do and I need help is a hurdle. The second hurdle is making sure those issues are in the treatment records, that you're getting physical exams, functional exams, MRIs, x-rays, and all the treatment and documentation necessary to show this is the diagnosis, these are the symptoms, these are the functional restrictions, and this is how it's affecting me at work. Within that, again, treatment records are designed for treatment and care. They're not designed for substantiating a disability claim. So Dr. X can hand the file off to Dr. Y and say, okay, you treated with Dr. X, this is what I've seen, and go from there. So that's why the insurance companies have something referred to as an attending physician statement form. And this is a 2 or 3 page document that the insured needs to present to their doctors, which allows them to expand upon the treatment records to an extent. That document will ask questions about date of first treatment, date of first symptoms, how frequently they're treating, verification of the objective medical evidence supporting the symptoms, the subjective complaints, physical exams, and then specifically it'll ask about restrictions and limitations, things the insured can't do, things the insured shouldn't do or is having to limit. And we'll go into the underlying medical basis of why that insured needs to either stop or reduce work activity. And we'll ask the doctor to specifically certify, did you tell Dr. Gary, or when did you advise Dr. Gary to reduce work activity? When did you advise Dr. Gary to stop working? Insurance companies typically will not move forward with a claim until that document is provided. Another document that's required is the claimant statement. The claimant statement is a form that you fill out It has a laundry list of information about who you are, your background, education, family members, medical issues. There may be a separate occupational questionnaire. Again, it's important that that information is accurate, consistent, and detailed. Again, it's not a time when you're looking to pursue a disability claim that you put on your stoic face and you try to present yourself in a better light than you're actually living in.
Mm-hmm.
You have to be open and honest. It's also important for you not to embellish, because one thing the companies will often do is they'll look at the attending physician statement, they'll look at the treatment records, and they'll say the information referenced in the attending physician statement is inconsistent with the treatment records. And that creates an issue at the time of claim. So we've talked about the attending physician statement. We've talked about the insured's claim form. I think another thing that's important is for the insured's to look at their medical records and understand that the information in that record needs to be thorough and complete. And if their doctor is maybe not documenting their symptoms, to discuss that. Or if they notice that they haven't been talking about their symptoms, they need to at the next appointment. It's also an opportunity for them to assess, are they getting appropriate care? Are there recommendations at the bottom, in the treatment plan that Dr. Gary should follow up in 3 months? Did you follow up in 3 months? Has it been a year since you've been back? If you're not getting appropriate care, the insurance company and their internal medical team, their consultants, are looking at the following and say, how severe are these medical issues if Gary is not following up and getting care? Mm-hmm. So another issue, and again, with doctors specifically, given their own knowledge and background, we often see that issue where they're not following up. And it's case specific and fact specific, but appropriate care, it's in the contract. Not only should they be doing it for their own health and well-being, it's a contractual requirement. Occupational documentation. It's the insured's burden to verify what the material and substantial or important duties of their occupation are. That's what the insurance is covering. So the company's going to request, whether it's production records, CPT codes, CDT codes, they need to verify. They're going to look for tax returns. That kind of goes into the financial component. That's all information the insured needs to provide. On top of that, we talk about tax returns, monthly pay statements. One of the issues I often see, it's not even someone that actually ever needs to retain it. It's, Ethan, I'm having an issue. The insurance company keeps asking me for information. They're being unreasonable. I asked them to send me the last correspondence. And it's the same information I just went over with you. And I'll say, Gary, they're not being unreasonable. You've provided the medical, but you haven't provided your financial information. This is a residual disability claim. How can the insurance company start assessing and analyzing its liability if you haven't provided the information they need to assess what your prior monthly earnings are, to assess what your current monthly earnings are, and whether there's a qualifying loss? Another reason insurance companies request the tax returns, and it gets a little tricky, sometimes we'll have doctors that have multiple sources of income. And the question then becomes, how much participation? Is it material participation? Is it passive income or active income? What are they actually doing? Is the doctor totally disabled, or are they actually partially disabled because they're having significant revenue from this other business entity that they're involved in? The insurance company's entitled to know that. I had a client or a potential client reach out years ago that took out the policy then when they were a practicing physician. Fast forward 15 years later, they transition into pharmaceutical industry. And I get a call saying, Ethan, I can't work as a doctor anymore. I say, okay, when was the last time you worked as a doctor? 15 years ago. Okay, when did your medical condition arise that prevented you from working as a doctor? 3 weeks ago, I had an injury. I said, well, that's great, and I'm very sorry that you're dealing with this, but the policy is, it's not your occupation at the time the policy was issued. It's your occupation, the material and substantial duties of the work activity you're engaged in at the time of disability. So they're entitled to verify that and assess that, and then look at how the medical and the symptoms and functional impairments result in restrictions and limitations in your ability to work. Again, getting that information in, it's a lot of information. It's tedious. So I always refer to this as the tennis match, where the insurance company is on one side, the insured's on the other, and the proof of loss, the information necessary to substantiate the claim, is the ball. So as long as that ball's on the insured side, the claim's not moving. And the wheels are just spinning and time is just passing and days, weeks, months are going on without the insured getting benefits. They need to be proactive, they need to be organized, and they need to ensure that anytime they get a question from the company, that they're getting that information to them in a timely manner. On my end, on the cases I'm involved in, I will get to a point with certain companies where I say, wait a second, we've provided the production, the financial, the medical for this set period of time. Well, we need to see next month's treatment records and next month. That's fine, we'll get that to you. But you have sufficient documentation from January to June to assess liability. Move forward with it, and it's a contemporaneous review. So it's just making sure all that information and knowing how to advocate for yourself a little bit. Another issue that I often see with people walking in my office and the clients I deal with, as I've mentioned throughout, is that most of the cases I see are partial disability claims. They start off as a partial disability claim and then transition into a total disability claim. Understanding when, I should say it this way, many of the doctors and dentists I deal with and professionals don't understand the partial disability rider or residual disability rider, and they don't understand when they had that qualifying loss of earnings. So there are a number of ways we factor that in, but all that information has to line up with the medical. So someone may come into my office saying, Ethan, I'm totally disabled as of this date. I had surgery. And I say, Dr. Gary, when did you first start getting treatment? Oh, 2 years ago. Okay. When did you start cutting back on work? 1.5 years ago. But you were getting care during that period of time. Yes. We have production records. So we see that while you come into my office saying, this is the date of my claim, they don't understand that, hey, there's actually a back benefit or retrospective benefit that you were eligible for and weren't aware of. And we work with our clients to get that. One of the hiccups with that is these policies do have notice requirements and proof of loss requirements. And depending on the jurisdiction that this individual is living in, that can interfere with or potentially preclude clients from going too far back in time. So it's understand the policy, knowing what is going to be requested from the insurance company, making sure that information that you're providing is clear, concise, and accurate, and that you don't drag your feet with getting them that information.
One of the things you had mentioned before, the attending physician statement. Familiarity with completing those statements or completing those documents for physicians on individual disability insurance policies versus, let's say, Social Security disability insurance, and just a little bit about that approach for the client, in this example, the patient, in getting their doctor to understand what they are completing.
In those situations, it's very important for the doctor to understand that this is not a workman's compensation claim. This is not a Social Security disability claim. This is a true own occupation disability policy. Some doctors are familiar with it. Some doctors aren't. Unfortunately, I've had cases where the doctor is looking at it from a Social Security standard, Social Security disability standard. We've sent a letter with the policy language to them advising that, no, this is a true own occupation individual disability policy. This is the criteria. Are you able to support restrictions and limitations?
Mm-hmm.
So it's step one is making sure the doctor is willing to support the fact that you're disabled and that they have the information they need to make that clinical medical determination. Once they've made that determination, it's about documentation. I say I live and die by the treatment records. And listen, if you have a doctor that has a treatment note that addresses every single question in the attending physician statement, then really the argument is you don't need to submit the APS because you have the information there. More often than not, that information isn't in the treatment records.
Mm-hmm.
In a case where someone's in a vegetative state, a truly significant disabling condition, the company, it would be hard pressed to say, we have the hospital record showing that Ethan is in a vegetative state and is hospital confined, and then require an attending physician statement on top of that. It'd be pretty unreasonable.
Mm-hmm.
But making sure your doctor understands and also being timely with it.
As long as it wasn't a self-inflicted injury that caused it.
Correct. But understanding that your doctor needs to be somewhat involved and following up with them. You have to advocate for yourself in this situation. So if you send something to your doctor, you have the conversation with your doctor. This is something I need. I need it in support for my claim. And let's say you're treating with 4 doctors. You don't need to submit 4 different APS forms. Find the doctor that's the most qualified to fill out the form. If I have an orthopedic issue, my dermatologist should not be completing my attending physician statement. It should be the orthopedist. But sometimes doctors are too busy to do it, or it's their practice not to fill out these forms. At that point, is there another doctor that you're treating with? Your primary care physician. I'm always amazed how often I'll work with a client that's treating with specialists. The primary care physician doesn't even know, or there's not even a primary care physician involved in the treatment team. And it's showing that you're getting qualified care and that it's appropriate, and then having a doctor that's qualified to sign off on that form and certify that you are in fact disabled pursuant to the terms and conditions of the policy.